If you as an owner feel that your horse is not going right, then generally you're right, although your trainer may tell you that you're not right. The horse should feel easy underneath you, and if it doesn't feel easy and if it doesn't want to go, then you need to be listening to the horse because he's trying to communicate with you.
Hi, my name is Caroline, founder of Equitopia. In this second video of our lameness series, Dr. Dyson delves into the protocol for establishing the main or multiple sources of underlying pain associated with subtle or obvious lameness. It is important to do a whole horse examination in order to have a comprehensive and accurate diagnosis that allows for proper planning of treatment and rehabilitation.
Whenever somebody comes to me with a horse with a problem, I want to ask a lot of questions because I can learn a lot about the potential underlying problems just from aspects of the history.
Dr. Dyson obtains a detailed history, which includes both physical and behavioral issues.
I want to know how the horse reacts to being tacked up. If they tell me the horse is fidgety, or it starts to bite when the girth is being tightened, or starts to kick, to me that's not a normal reaction. If the horse goes to the back of the stall when you approach with attack, that's not a normal reaction. If the horse is fidgety when the rider gets on, that too is not a normal reaction. So all of those signs indicate to me that there's likely to be an underlying pain-related problem. Then I ask the owner, how happy is the horse in walk and trot? Can you tell me, is there any difference between the left and the right reins? How does the horse perform transitions? Is the horse willing? Is the horse relaxed or tense? And they will frequently give me information. I'll say, oh, well, he's always been a lazy horse, but he's got worse. Or I used to be able to turn easily to the left and to the right, and now it's more difficult to turn to the right. And those sorts of things tell me that there's likely to be an underlying pain-related problem.
Next, Dr. Dyson conducts a thorough clinical exam.
Whatever sort of lameness I'm looking at, I have to do a comprehensive clinical evaluation of the whole horse. So this is from head to tail with everything in between, both at rest and watching the horse in motion. Feel each limb, pick up each limb, flex all the joints, assess the range of motion of the joints, whether or not movement of the joint induce pain, palpate all the tendons and ligaments to see if they were normal size or whether or not any pressure caused pain. Look at the horse and assess its muscle symmetry because asymmetry generally reflects an underlying problem. Look at the overall musculature of the horse because if the horse has got a very well muscled neck but the back is rather poorly muscled, that means the horse has probably not been using its back normally, and that generally reflects that there's an underlying problem.
After lots of listening, observing, and palpating, Dr. Dyson moves to watching the horse in motion.
Move in hand, flexion tests, that's flexing a joint for approximately a minute and then seeing the horse trot off. I always look at horses on a soft surface first, because on a soft surface, if the horse does anything stupid, it's not going to injure itself probably. Whereas if it leaps up and down on a firm surface and then it slips on landing, it may injure itself, and that's the last thing I want to happen. On a soft surface, if the lameness is accentuated compared to straight lines, that's more likely to reflect an underlying soft tissue injury, whereas bony problems or joint problems are more commonly accentuated on a hard surface. But there are no hard and fast rules. Horses don't read textbooks. We're just talking in general terms. So there are some lamenesses which are really obvious in straight lines. Frequently they may be exacerbated in circles. So if the horse is lunged in a circle, be it on a soft surface or a hard surface, then the strains of moving in a circle are going to change the loads on the inside and outside limbs, both in front and behind, and that can exacerbate some lamenesses. It can help us sometimes to differentiate between whether a head nod reflects a hind limb lameness or is a reflection of an additional forelimb lameness. Because if the hind limb lameness stays the same going on the circle, but the head nod becomes much more obvious, that generally means there's a concurrent forelimb lameness in addition to the hind limb lameness. Some hind limb lamenesses are less obvious on the lunge than they are in straight lines, because on the lunge the horse tilts its body a little bit, so the movement of the hindquarters is somewhat masked, so it can be more difficult to identify the lameness. Although if you're lunging the horse on an arena, toe drag may be accentuated because you can see the arena surface being kicked up and you become more aware of it. And then ideally, I think the horse should be evaluated ridden unless the horse is too lame to do so. Many vets don't see horses ridden. I think they're missing a great deal by not doing so, because there are many lamenesses which are only apparent in the ridden horse, which may be because it's purely the loading effect of the rider, or it may be what the rider is asking the horse to do. So, for example, the Grand Prix dressage horse may only show its problem as far as the rider is concerned in canter pirouettes to the right. And the problem to me as the veterinarian may only be apparent in canter pirouette to the right. So I have to see the horse do that. And it's, I'm going to learn probably nothing by looking at the horse under other circumstances. And this applies both to forelimb lameness and hindlimb lameness. There's been historically a perception that because lameness is accentuated when the horse is ridden, this must reflect, at least in part, a back-related problem. And that's, I think, a misconception, because any lameness, be it in the forelimb or a hindlimb, can be accentuated by the weight of the rider, just by how the horse is having to adjust its balance to accommodate the weight of the rider. Many of those horses will have some secondary back muscle tension, but that is secondary, not primary. I like to see the normal rider ride the horse, so I know what influence they have on the horse. And many times the normal rider will ride the horse when I'm blocking it. But I'm also often quite interested to see how the horse goes with a different rider. And many of the horses that I look at are in the clinic for a couple of days, and one of my riders will ride the horse. And they can be a little bit more objective. The owner often wants to have improvement with a specific area of pain, so we'll say, oh, I think the horse feels a lot better, and I look at it and I think, no, the horse isn't a lot better in actual fact. So by using one of my riders, we can create some degree of objectivity, because it doesn't matter to them where the pain is coming from. And they're better able to say, okay, yes, I think this horse has improved, but I think there's still residual pain. And then there's sometimes when I will get on the horse myself, because sometimes there are problems that I find difficult to see, but the owner has told me about things, and I get on, I think, oh wow, yes, I understand now completely what's going on. I talk about using ridden exercise as though it's the only way to go, but you have to be aware that there are some limitations of that. So, for example, the lameness may be influenced by the diagonal on which the rider sits. So a right hind limb lameness is generally worse when the rider sits on the left fore right hind diagonal. So you've got to be really careful when you're reassessing the lameness. Then you will have the skill of the rider.
We can hold them together and make them look slightly better or slightly worse in some cases.
If the rider is slightly out of balance with the horse, then they may be influencing the gait in a negative fashion, which is going to confound your interpretation of what's going on. Some riders are able to mask lameness because they can inherently ask the horse to do a little bit more with its hind limbs and therefore make the lameness less obvious. Some horses are lamer when ridden to a contact, others are lamer when ridden on a long rein. So I will frequently ask the rider to go around the arena on a long rein and then pick up the contact and see what happens, and then go on a long rein again, in order that I can see the influence of the rider.
The goal for Sue Dyson isn't just to find the lameness, it's to find all the lameness.
When you have multiple problems, you often get secondary problems. Now, for example, sacroiliac joint region pain is a common secondary problem. One of the hallmarks of sacroiliac pain is that it's considerably worse when the horse is ridden versus when it's seen in hand or on the lunge. And another thing about sacroiliac pain is it often influences the canter more than the trot. People seem to think about lameness as seeing it in trot. Yes, I can only pick the limbs in trot, but there are some horses in which their primary problem is in canter. So it's really important that we evaluate the canter as well as the trot.
By this point in the evaluation, the problem limbs have been identified.
But the next move has to be to establish where is the source of pain in those limbs. And the only way I can find that out is by using nerve block techniques. That is, I'm going to inject local anesthetic over nerves to desensitize a part of the limb, for example the foot, and ask the question, has the horse got foot pain? If the gait does not change, it tells me the horse does not have foot pain. If the lameness is much improved, it tells me I have foot pain. And I can work sequentially up the limb at different levels until I have removed the lameness. So then I can say, this is the source of pain, and I can then investigate that specific area by imaging techniques such as X-ray and ultrasound, and if necessary MRI, to determine what is the structural cause of pain and lameness. If we have isolated where the pain is coming from, we should see dramatic improvement, not only in the lameness, but also the horse's overall way of moving, particularly under saddle. So the horse that was going in a rather stiff and restricted way, I would expect to see much longer striding, looking much more athletic. I would expect to see more swing through the back. I would expect to see the horse being happier. I would expect that the horse may change its entire way of movement because it's altered its balance. So it, for example, may bring the hind limbs further underneath it so it was less on the forehand, stretch its head and neck out, better quality contact with the bit. So the horse may go from a horse which was really tight and restricted to a horse that looked much more open and happy. I think when we perform nerve block techniques, we expect to see substantial improvement in the baseline lameness. And I think it's really important to grade the lameness under each circumstances under which we've seen the horse move. So in hand, on the lunge to the left, the lunge to the right, and ridden under various circumstances. And then regrade the lameness after the improvement, after the nerve block. And say, well, if we've gone from grade 4 out of 8 to grade 1 out of 8, that's a pretty big improvement. We then have to ask, well, why is there residual pain? Have we failed to eliminate the primary source of pain? Is there another source of pain?
Dr. Dyson points out that occasionally, certain types of pain cannot be entirely eliminated by nerve blocks.
So, for example, if you've got a horse with a subsolar abscess, it can be really difficult to completely abolish the pain because you've got all sorts of pressure receptors in the foot and you've got swelling within the confines of the hoof capsule, so difficult to abolish that lameness completely.
When a horse is lame, it will almost always stiffen its back to compensate, and some muscle pain is still going to be present, even after nerve blocks.
Muscle pain in the back, for example. We can't abolish that muscle pain, so that may still influence the way in which the horse is moving under saddle because the horse is using its back muscles when it's being ridden. And we also know from work done in people that neural pathways change when you have pain, which will influence, for example, how you place the foot to the ground. And I think the same thing happens with the horse as well. But those types of gait abnormalities are subtle. We should be aiming to get to, at greatest, a grade 1 out of 8 lameness, and I would be hoping to get closer to a 0 out of 8 lameness following nerve blocks, if I've successfully identified all the sources of pain.
Sometimes there are situations where Dr. Dyson chooses not to do nerve blocks.
Sometimes the clinical examination leads us to a diagnosis because, for example, the horse may have swelling of the fetlock joint capsule. When you pick up the fetlock and flex the fetlock, that clearly hurts the horse. And so you've got a very clear idea that this at least is one of the sources of pain and lameness.
At that point, Dr. Dyson would move to either X-ray or ultrasound imaging.
Sometimes you get the horse with a diffusely filled limb because it's had a little nick in the back of the pastern and that's got some cellulitis now, and then you can't do nerve blocks. It's too dangerous to do nerve blocks under those circumstances because you may spread infection elsewhere. So then you've got to wait to treat the primary problem, which actually is not related to the underlying lameness. That's just a red herring. There may be from the clinical history that there is a suggestion that you've got a fracture, and then it would be contraindicated to do nerve blocks. But in the vast majority of horses which are performing poorly, you're not going to be faced with those situations. In the vast majority of those horses, it will be safe to do nerve blocks, assuming the patient is tolerant.
It's worth noting that when a horse has pain in multiple places and a nerve block eliminates pain in one area, the horse may feel pain more acutely somewhere else.
So the horse's predominant pain initially was coming from, for example, the left hind limb, but now the predominant pain is from the sacroiliac joint, and the horse finds it much more uncomfortable in canter because the canter is a 3-beat asymmetrical gait versus the 2-beat symmetrical gait of trot. So when they get into canter, they suddenly think, oh, I hurt, more than they had done before because the balance of where the predominant pain was coming from has shifted. Sometimes I can see that the horse is very tense, or the owner may be complaining about tension, or the fact that the horse isn't going properly. And the question is this or is this not pain related? And sometimes I need to convince the owner that there's an underlying pain related problem. And then I may choose to advise that the horse goes through a course of phenylbutazone. That course has got to be of a sufficiently high dose for the body weight of the horse and for a sufficient period of time to see a beneficial effect. If the horse is substantially improved whilst it's being treated with phenylbutazone and then deteriorates when we stop the phenylbutazone, that tells us categorically that we've got an underlying pain-related problem. However, there are some false negative results. There are some sources of pain, for example the sacroiliac joints, which don't necessarily respond particularly well to medication with phenylbutazone. So a positive response means there's definitely underlying pain. A negative response does not preclude pain 100% of the time.
And of course, make sure your tack isn't the source of your horse's discomfort.
If your horse is not going correctly, there are certain things that you need to check that are right for the horse. So you've got to check that its tack fits, that the saddle is not too tight for the horse, that the saddle is not moving excessively, that the girth is not pinching around the elbows, because all of those things can compromise the horse's gait. You need to seek the advice of a saddle fitter whom you respect, ideally somebody with appropriate qualifications. And I would strongly recommend that you seek the advice of an equine veterinarian who is skilled with dealing with performance horse problems. Because if you go to your GP vet, they may not have sufficient skills to be able to identify the underlying problem.
If you find our videos helpful on your path to compassionate horsemanship, we invite you to join our community. For more videos and information, please visit our website at equitopiacenter.com.